I am Dr. L. Prakash, an orthopedic surgeon from Chennai, India. This is a short animated film for patient education about a new procedure of knee preservation called PFO, or proximal fibular osteotomy. Thank you for watching the film. Consult your orthopedic surgeon and discuss the possibilities of a PFO before you decide to undergo a total knee replacement.
Hello, doctor. I have come to you to consult about my mother's knees. She is having a terrible knee pain on both sides and is hardly able to walk.
How old is she? What are her symptoms? Is she overweight? Do you have x-rays?
She is 51 years old, and we have consulted 4 orthopedic surgeons. 3 of them have advised a total knee replacement. These are her x-rays. We have heard that you are doing knee preservation, and so I decided to consult you.
Her x-rays show a medial compartment osteoarthritis. We can defer or delay knee replacement for 5 to 10 years, or even longer by a very small surgical procedure called PFO.
Well, doctor, what is PFO?
Oh, it is just cutting a small piece of the smaller bone, fibula on outside side of knee, and this balances the knee. We won't be either entering the knee joint or opening it up.
What? You mean that you won't touch the knee joint at all?
No! That remains virgin, for a knee replacement, should it be needed. You see, in your mother's knee joint, the space on the inner side is less, and the outer side is more. By removing a small piece of fibula at the correct level, the gap on the inside or medial side will increase.
That is indeed surprising. How does it work? How did you find out that this happens? Seems so unscientific to me.
Well, young lady, Drive L. Prakash was in prison for a while, and there he found that knee arthritis patients who were beaten by cops and broke the fibula had dramatic relief from knee pain on the medial side. And when the prisoners had their x-rays a few months later, their joints looked surprisingly better. That gave him an idea.
Well, sir, my mother will very much like to see you. Only you can convince here to meet this Drive L. Prakash, would you please come with me? My house is just a 10-minute bus ride away. While we wait for the bus, can you tell me one thing? How did you take that idea forward?
Around 10 years ago, Dr. Prakash's aunt was scheduled for a bilateral knee replacement. He offered her a simpler solution, because her knees were not so bad. Not only did she have a dramatic relief of her symptoms, but the relief lasted for over 10 years. Even today she refuses to undergo a knee replacement.
Well, doctor, that required some courage. I'm happy that your boss's index surgery worked well. But when did he actually start doing this procedure on patients?
That is an interesting story indeed. He was released from prison some 3 years ago. Dr. Prakash is extremely passionate about knee joints, and continued my prison research outside as well, and learned and taught many things not mentioned or described in the books.
Things not described in books? Like what?
Fibula when lengthened decreases medial joint space and causes arthritis, as I am showing you in this x-ray of a very young person with premature medial osteoarthritis in teenage itself.
Wow, that is indeed surprising. And does the opposite also hold true? That is your theory, isn't it?
Yes! Now you see these x-rays. By removing a small piece of fibula, the medial joint line opens up automatically. Here comes the bus. Well, madam, your daughter had to go away for an emergency, and here I am to talk to you about your knee condition. As I told your daughter earlier, your medial osteoarthritis needs PFO on both sides.
Well, doctor, sir, what is this PFO?
Oh, it is just cutting a small piece of the smaller bone, fibula on outside side of knee, and this balances the knee. We won't be either entering the knee joint or opening it up.
And does it really work? How does it work if it does? And how many cases have you done?
It works, no doubt. Drive L. Prakash has just completed his 250th case. All patients are doing well except 3. As to how it works, we are still finding out. However, he has also written a book, and now many surgeons are doing this procedure all over the world. His book is now being used as a standard reference via anyone performing this surgery in large numbers.
Okay, doctor, please explain to me what this procedure is all about. How is it done? How long does the procedure take? How long will I have to be in the hospital? How soon will I walk? When will I recover fully? What are the side effects?
PFO is a simple surgery. You make a small cut on outside of the knee and take away a very small piece of fibula. First we shall record your VAS scores and examine your knee. Before surgery, the surgeon inspects the joints under a C-arm. He evaluates the medial joint space. And in all cases it is rather narrow, and sometimes even minimal. Knees are bent inwards with a gap between knees while standing, and this is called varus.
Just like my knees, doctor. Okay. Carry on. This is interesting. Will I be fully asleep during surgery?
No, the procedure is done under regional anesthesia. The legs alone will be numb. You will be fully awake during surgery, but we will give you a little sedation to ensure that you stay calm or sleep during the procedure. Both legs are usually done at the same time, and each side takes less than half an hour. The knee is cleaned and draped. Using a special scale, the level of cut is marked, depending on the patient's height and degree of medial joint involvement. We perform the surgery one by one. Fibula is more or less a superficial bone, and can be felt easily. A 2-inch incision exposes the bone, which is carefully visualized without damaging soft tissues, especially the nerve. The correct osteotomy level is marked, and drill holes are made at the upper and lower levels of our desired cut area. Then using a power saw, the small measured 1 centimeter piece is removed from fibula. If the bone bleeds, it is controlled by bone wax. The wound is closed in layers with 3 or 4 skin stitches. The patient is shifted to the ward.
Doctor, will the post-operative period be extremely painful?
No, madam. We would be infiltrating locally anesthetizing and numbing medicines while we perform the closure, and this will keep you significantly pain-free till the evening. Additional painkillers are given, should you need them.
Doctor, how long will I have to remain in bed after my bilateral PFO?
Most patients stand up on their own and are able to walk with or without support to the toilet by 8 hours of surgery. Within a day, they are all able to walk independently. In your case, I can expect you to try climbing stairs on the next day of surgery, and if you are able to do that comfortably, you can be sent home.
Okay, doctor, a few more questions. Let's have a cup of coffee and discuss the points. What happens next, doctor? How many days should I be on rest? When will I be able to resume my regular activities?
You should be walking normally in about a week, and by the 14th day, we will remove your sutures.
When will I begin getting pain relief, and for how long will it last? When will my X-ray become normal again?
Well, madam, most patients get immediate post-operative pain relief. The pain relief is expected to last anywhere from 5 years upwards, significantly delaying or postponing a knee replacement. As far as the X-rays are concerned, some widening of the inner joint spaces is indeed seen, but most often the dramatic pain relief felt by the patient is not reflected in radiological changes.
Doctor, what are the complications and side effects which could happen with this surgical procedure?
All surgical procedures have their minor and major risks, and PFO is not an exception. As it is a smaller surgery, there are no major complications anticipated. However, 2 common minor problems happen to a small number of patients. They can get a numbness on front of foot, slight weakness in moving the great toe, or very rarely foot drop.
Doctor, why does this happen?
This happens because of small incision or forced retraction, which may stretch the nerves, causing neuropraxia. With meticulous technique, the incidence of this complication is reduced to less than 5%. As you can see from the pictures, use of spike retractors stretches the skin and should be avoided. So if properly done, it is unlikely to cause any neurological troubles.
Doctor, can you please show me a short video of the surgical procedure? I want to see what you actually do.
Here you go. Let me show you Dr. L. Prakash's demonstration of this procedure in a patient. Let's go to the big screen.
I am Dr. L. Prakash and I am demonstrating a procedure called PFO, or proximal fibular osteotomy. The preoperative X-rays show severe medial arthritis of both knees with the medial joint space almost gone on both sides. Both knees are prepared together. They are cleaned, draped and prepared in the standard manner. Here the right side will be done first. followed by the left side. The correct level is identified with a notched scale and marked with a hypodermic needle, pushed right up to the fibula. A 2-inch incision is made on the lateral aspect, and the fibula palpated with the index finger. Retraction is gentle, and the bone is exposed. The upper and lower level of the bone cut are marked with drill holes. Using a power saw, the upper and lower levels of this are cleanly cut. One must be careful with the saw and use it in slow controlled movements. The broken piece of fibula is now removed. The incision is closed in layers. The similar steps are followed for the opposite side as well. A 2-inch incision is made on the lateral aspect, and the fibula palpated with the index finger. Retraction is gentle, and the bone is exposed. The upper and lower level of the bone cut are marked with drill holes. Using a power saw, the upper and lower levels of this are cleanly cut. One must be careful with the saw and use it in slow controlled movements. The broken piece of fibula is now removed. The patient walks within hours of surgery and is fit for discharge the same or next day.
Wow, that video was indeed impressive. Just a few more questions for you. Is PFO an accepted procedure? My daughter told me that it was an experimental procedure, not approved, and being performed only by you or your team. Will my Mediclaim insurance policy cover this surgery?
Madam, in a way you are correct. The procedure began as an experimental surgery and was restricted to friends, relatives, and orthopedic surgeons. In fact, senior orthopedic professor Drive K. P. Daigle himself underwent this procedure and has been able to delay his knee replacement by many years. And once it became established, it rapidly became popular. Then came international publications, and all of them referred to and quoted the Prakash study and Prakash procedure. The procedure of PFO gradually gained acceptance, and presently it is being performed in 100 centers in 42 countries, in large numbers. In addition, all insurance companies have approved of the procedure, and the current package of Rs 80,000 to a leg per knee is usually approved by insurance companies for this procedure.
Okay, Dr. Prakash, on last question. You told me that you do not know how long the effects of this procedure will last. Few years to a decade, you explained. After that, when my joints are fully damaged, I will certainly need a knee replacement. Will that procedure be affected by the earlier PFO?
Absolutely not. The knee joint remains virgin and untouched. And an earlier history of PFO may actually make knee replacement joint balances a lot easier. You can go ahead if your pain is severe enough.
I am Dr. L. Prakash, an orthopedic surgeon from Chennai, India. This is a short animated film for patient education about a new procedure of knee preservation, called PFO, or proximal fibular osteotomy. Thank you for watching the film. Consult your orthopedic surgeon and discuss the possibilities of a PFO before you decide to undergo a total knee replacement.